Well, hello everyone. In today's video, we're going to talk about the parts of Medicare. I'm going to make it really simple for you to learn it and retain it. So let's get started. So let's first talk about original Medicare really quick, and then we'll talk about the parts of Medicare. So original Medicare is health insurance for individuals turning 65. You work in the US, you paid into Medicare taxes, you worked 10 years, at least 40 quarters, and now you qualify for Medicare, right? Or you became disabled at some point, you still had enough working credits, and you got SSDI disability with a qualifying disability, and you got Medicare after 24 months. So that is Medicare, original Medicare, and original Medicare has several parts. So you have Medicare Part A, you have Medicare Part B, Medicare Part C, and Medicare Part D. So let's start with Medicare Part A. The easiest way to remember Medicare Part A is remember the letter H. Medicare Part A is your hospital coverage. So it's going to cover hospital stays, it's going to cover home health services, it's going to cover hospice, and it's going to cover skilled nursing home care. Okay, so that's your Medicare Part A. Now, when it comes to Medicare Part A, I don't want you to confuse skilled nursing care with long-term care because it's not the same. So skilled nursing care is when you need to go into a skilled nursing facility for rehab or something that requires a qualified registered nurse to maintain your health or to help you get back in health. Maybe you need to go into a skilled nursing home to regain your strength. Maybe you had a recent stroke or something like that, and you need to go in there to, get IV medications, to get therapy and such. So that is considered skilled nursing home care. Now, when it comes to long-term care is when you need to be there long term. Maybe you need to go into a nursing home and be there for the rest of your life. You need help with everyday activities such as eating, dressing, bathing, getting up and out of bed. That is long-term care, and Medicare does not cover long-term care. You would need to pay privately or through a long-term care insurance policy or through Medicaid. Medicaid does cover long-term care. So we talked about Medicare Part A. Now let's talk about Medicare Part B. Medicare Part B is your medical insurance coverage. So it's going to cover things outside of the hospital, okay? So it's going to cover your doctor visits. It will also help with home care as well. Medicare Part B will help with labs, diagnostic procedures, durable medical equipment. It will help with certain tests and treatments and things. So Medicare Part B, like I said, is outside the hospital, ambulance care, tests, treatments, labs, diagnostic procedures, case studies, research, like medical research is all covered under Medicare Part B, and also medications that you take at your doctor's office. So that could be chemotherapy, that could be an IV medications, that could be an injection, your flu shots, your pneumonia shots, your shingles, all of that is covered under Medicare Part B. Now let's talk about Medicare Part C. Medicare Part C is not original Medicare. It's actually a replacement of original Medicare. Medicare Part C is Medicare Advantage plans. So individuals would get on a Medicare Advantage plan because original Medicare only covers 80%, leave you behind 20%. So because there's no cap, there's no protection with original Medicare with that 20%, individuals would get on a Medicare Advantage plan. And what happened is original Medicare will pay these Medicare Advantage companies to take on your risk. So these companies would get about $1,000 or so per month per member to take on your medical risk. So because they're taking on your medical risk, they do a share of cost with you, right? So basically, the 20% is not a factor anymore. You do a share of cost. A lot of times these Medicare Advantage companies would be $0 per month, but you have copays. Like I said, you have a share of costs. So usually you pay your copays and the insurance company will pay the rest. Usually you will have a max out of pocket, which is good because you have protection versus just paying 20% with no protection at all. So a max out of pocket could be $3,000. It could be $10,000. It really depends on the Medicare Advantage plan that you choose, right? So let's go back and talk about copays. So usually a copay, and these are examples of copays. Of course, it depends on the actual Medicare Advantage plan company, the state you live in, your zip code, and all of that, right? So some examples are $0 copay for a regular doctor visit, $20 copay for a specialist visit, $50 for an ER visit, $30 for an urgent care visit, $100 for x-rays, $250 a day for hospital stays for days up to 1 through 5. And then after that, the Medicare Advantage plan will pay the rest. So that's how that works when it comes to a Medicare Advantage plan. Now, with a Medicare Advantage plan, these plans are not all the same. Think about it as a fruit basket. You have apples, orange, all of these fruits. They're fruits, but they're not the same, right? So these Medicare Advantage companies are different. They have different benefits. They offer different co-pays and such. So it's very important that when you look at a Medicare Advantage plan to really look at your particular needs. Sometimes I have clients that says, hey, you know, my neighbor has XYZ plan, but that may not be the best plan for you. So we want to look at your doctors, your medications, anything special going on. Do you have home health? Do you have dialysis? Do you go to any specialty clinic? Do you have a chronic condition such as diabetes or COPD? What medications you're taking to manage these diseases? We're going to look at all of that, and then we're going to narrow down maybe 2 plans, and from there you could choose what plan you want to be on. And of course, we look at your doctors. Do your doctors take these plans? We look at the network as well. There are HMO plans and there are PPO plans. With an HMO plan, you have to stay within network. You also need a referral to see a specialist. Now, your benefits will be a lot more, like you get more dental, vision, and hearing. Now, with a PPO plan, you don't have to stay within network. You don't need a referral to see a specialist. You have more freedom to see doctors outside of the network. However, you would pay more for these doctors outside of the network most of the time. Okay, with a PPO plan, the benefits could be a little less, such as dental, vision, and hearing, okay? So with the Medicare Advantage plan, since we're talking about benefits, they do include extra benefits that original Medicare does not include, such as dental, vision, hearing. Some of these plans will even help with transportation to the doctor, will help with healthy groceries if you qualify for a chronic special needs plan, or if you also have Medicare and Medicaid. And of course, these plans is based on location. Not all states offer these extra perks and benefits. It really depends on where you live, the type of plans that's offered in your area. Okay, now with a Medicare Advantage plan, you could also include prescription drug coverage as well. So a Medicare Advantage plan is an all-in-one plan. And like I said, this is also known as Medicare Part C. Okay, now let's talk about a Medicare supplement plan as well. Now you can decide to go with original Medicare with a Medicare supplement. Now with a Medicare supplement, it works a lot different than a Medicare Advantage plan. With a Medicare supplement, the supplement will actually pay the 20% that Medicare leaves behind, which is really nice. So you're just paying an additional monthly premium for your supplement plan, and the supplement plan would do the rest. So with the Medicare supplement plan, you don't have to worry about pre-authorization. As long as original Medicare covers the service, then the supplement will follow and pay the 20%. You don't have to worry about doctor networks as well. As long as the doctor takes original Medicare, you can use your supplement plan. It'll just follow the bill and pay the 20%, like I said, and you could travel with it as well within the US. As long as the doctor takes original Medicare, they'll take your supplement, of course, if they're taking new patients, okay? So the Medicare supplement is nice to have. A lot of individuals would get on the Medicare supplement plan if they don't want to have to worry about network, and they don't have to worry about pre-authorization. Individuals would go with a Medicare Advantage plan if they just simply cannot afford the Medicare supplement. That's what I have noticed with my clients, okay? Now let's talk about Medicare Part D. So this is going to cover your prescription drug coverage, medication that you're taking at home prescribed by your doctor. Like I said, if you're taking a medication at your doctor's office, then that is covered under Medicare Part B. But the medications you're taking at home prescribed by your doctor, that's covered under Medicare Part D. Now, if you're on a supplement plan, you also need a standalone drug plan. And if you have a Medicare Advantage plan, then most likely your drug plan is included in your Medicare Advantage plan. Now, if you're not taking any medication, do you need to still get on a Medicare Part D plan? Yes, you still need to get on a drug plan even if you're not taking medications. Now, if you're getting medications through the VA or TRICARE, then that is fine. But if you're not, then you definitely need to get on a Part D plan if you don't have employer's coverage through your employer, okay? So that's very important to know that you do need a drug plan when you're eligible for Medicare. You do not want to delay that because you will be penalized. You do not want to delay Medicare Part B as well because you will get penalized for that as well. Now, we talked about the parts of Medicare. We talked about Part A, which is your hospital coverage. Part B is your medical coverage. Part C is Medicare Advantage plans. Part D is your prescription drug coverage. Now let's talk about the cost. So Medicare Part A does not have a monthly premium. The monthly premium for Medicare Part A is $0 if you worked in the US and you paid Medicare taxes, like I said, 40 quarters or 10 years. Medicare Part B, however, does have a monthly premium. For 2025, your Medicare Part B premium is $185 per month. And you also have a Medicare Part B deductible as well. And your Part B deductible for 2025 is $257 for the year. So if you have original Medicare and you have a Medicare supplement, you are responsible for your Part B deductible unless you have Plan F. However, Supplement Plan F cannot be sold to anyone turning 65 after January the 1st, 2020. So the Medicare supplement plans are categorized by letters, and they're all pretty much gives the same exact coverage. The only difference is the insurance company that you go with and their monthly premium for that Medicare supplement plan, okay? So like I said, your Part B has a monthly premium of $185, and then you have your Part B deductible of $257. You do have to pay that deductible before the supplement will kick in. A lot of times when it comes to a Medicare Advantage plan, you don't have to pay a deductible. The deductible is covered under the Medicare Advantage plan. Now, let's talk about something called the IRMAA chart. The IRMAA chart is going to determine how much you actually pay for Medicare Part B. Most individuals will pay the $185, but if your income meets a certain threshold, and I'll put the IRMAA chart right here so that way you could pause the video and see how much you would pay in 2025. You will pay a lot more if your income is under a certain threshold, and it does go by your adjusted income in the prior 2 years. So it will go by the last 2 years of your adjusted gross income, and that would tell you how much your Part B premium is. But like I said, most individuals will pay $185 in 2025. Alrighty, so we talked about the parts of Medicare. If you have any questions, please leave them in the comment section below. If you need any assistance when it comes to Medicare, give our office a call. We'd be more than happy to assist you. We never charge for our services. We get paid directly from the insurance carriers. We help individuals with Medicare supplements and Medicare Advantage plans as well. Thank you so much for watching this video. If you know anyone that needs assistance or can utilize this video, please share this video with a friend. Subscribe to the channel if you're not already subscribed to see me again. Thank you so much for watching, and I'll see you on the next video. Bye.